I'm the nursing professor here today, and we're going to discuss the nursing process. Now, I know you've heard this before. You know the acronym of A.D.P.I.E, but let's go into it a little deeper so that you understand exactly what this means. So, first one is assessment. This is where we're going to gather data from our patient. We're going to get both objective and subjective data. Remember, subjective is that data that you collect from your patient. These are questions that you're going to ask and the person is able to respond. The objective data is going to be things that you assess, like vital signs or blood glucose values or labs or urine tests where you see if ketones are in the urine and things like that. To diagnosis, want to make you, tell you to pay attention to this. A medical diagnosis and nursing diagnosis are different. So in the case that a person has new onset diabetes, that would be a medical diagnosis. Whereas a nursing diagnosis is how that diagnosis is going to impact your patient. And so for us as nurses, it might be something like knowledge deficit, or a person is at risk for hypoglycemia or hyperglycemia. Our plan needs to be specific. It needs to be measurable, because if not, then you can say the person will be able to test their own blood glucose. Well, and how long? Hospital stays are shorter and shorter these days, and so we want to make certain that when we come up with a plan, that those items that we want the person to be able to do, that we have a timeline on it, so then it'll cue us in to go back and reassess. So in our plan, we might have something like person will be able to check their own blood glucose within 24 hours of admission. All right, next we have to put that plan into action, and that's called implementation. And so here are all the things that you're going to do with your patient in order for them to be successful in their personal care. So that might be things like educating your patient on the disease process, teaching them how to use the blood glucose machine, teaching them how to eat properly, looking at their carbohydrates. Carbohydrates break down into sugars, and things like that. So it's a whole list of things that you might go over with your patient. And evaluation is the time that you're going to use to assess whether or not your patient got it or not. Are they able to return demonstration of the glucometer? Are they able to tell you some signs and symptoms of hypo or hyperglycemia that they need to look out for? So next, I want to give you a couple of questions and see if we can put this into practice. All right, so question number one. A nurse is performing an initial assessment on a patient recently diagnosed with type 2 diabetes. Which of the following findings is most important for the nurse to assess further? All right, so here's your choices. A family history of diabetes in the immediate family. We know there's some genetic tendency there. B, the patient complains of frequent urination and frequent feeling of thirst. Again, we know that's signs and symptoms of diabetes. C, blood glucose of 120 before breakfast. So that's going to be your fasting blood sugar. So if that person's blood sugar is 120 or more, if that's of any concern. And your last choice is D, a history of hyperlipidemia. People's cholesterol are up in the patient's medical records. So which of those four would you think would be the answer? Okay, so I'll give you a few minutes. You can drop your answer down below, and I'll give you the answer at the end of this video. So we're going to go on to question number 2. All right, so sticking with the same idea of a person that's newly diagnosed with diabetes. Number 2, a nurse is planning care for a patient with diabetes who is newly prescribed insulin. So it's the first time on insulin, so we know there's a lot that needs to be done with this patient. Which of the following actions is the nurse's priority to helping the patient manage their condition? A, teach the patient how to measure and record blood glucose levels before meals. B, educate patient about signs and symptoms of hypoglycemia, blood sugar low, and how to manage it. C, encourage the patient to follow a low-fat, high-protein diet to control blood glucose. Or D, provide a written meal plan for the patient to follow with strict carbohydrate restrictions. So which of those 4 are a priority? So all of those could be important, but the question is asking about priority, which thing is most important. All right. So answer to the first question was B. B as in boy. And the rationale behind that is if the person complains of frequent urination and increased thirst, we know that's a classic sign of diabetes. Pee, 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 and drink, drink, drink. A person complains of that and it's a sudden change for them, then 9 times out of 10, they really do have some sort of alteration in glucose that's going on and they need further testing. To question number 2, the answer again was B. The rationale behind that is we want to make sure that a person just starting on insulin therapy, that they understand and know the signs and symptoms of hypoglycemia and hyperglycemia. That is essential because we know people, when they first start insulin therapy, then the blood sugar takes a little time to be regulated. And we don't want someone to take too much insulin or not get enough insulin. And so hopefully that makes you a little more comfortable with the use of the nursing process. This can be used anytime that there's a question because these steps go just in order that they are. You can't skip over one. So it's going to help you as a student answer questions. It's going to help you understand how to develop a nursing care plan, which is always 10% of your grade, and should help you throughout all of your nursing courses. If there's any questions, drop them down below. I'll be sure to answer them. And like and subscribe to this channel, and I'll see you next time. Bye for now.